Good morning, everyone. I once again welcome you all to the lecture series on drug abuse, problem management, and prevention. Today, we'll discuss about what are depressants, its common types, and effects. Let's start with the introduction. Depressants are the drugs which slows down or curbs down the activity of central nervous system. These are the drugs which calm the nerves and relax the muscles. Doctors use them to treat conditions like anxiety or insomnia. Many mental illnesses also include depression as a part of the medication treatment. Depressants are also used as sleep aids or anti-seizure medication to cure anxiety and tension. Physical and psychological dependence can be easily caused by depressants. Depressants are the drugs which dull the consciousness, induces sleep, and relieves anxiety or pain. So these are the common types of depressants. Alcohol is widely abused substance worldwide. It is one of the serious drug problem in India today. It has a biochemical effects similar to those of anti-anxiety agents. It is also anesthetic because it deadens the pain in the body. But effect of the alcohol is highly dependent on its dose. It has depressant action on central nervous system, such as whenever alcohol enters the body, it reaches the bloodstream, it goes to the brain, and suppresses the thought process and muscle coordination. Some individuals use alcohol for recreational purposes, and alcohol has sedating effects such as anxiety reduction. So these are the short-term effects. The short-term effects of alcohol are there will be reduced tension, slow reaction time, reduced coordination, slower brain activity will be there, slow reflexes, sensation and perception will not be clear, sleepiness, and altered emotions. If person is using alcohol at large doses, then he or she will experience long-term effects such as disrupt normal brain development, liver damage will be there, brain cell die or reduce brain mass, blood pressure increases, it causes heart diseases or heart attack, fatal alcohol syndrome in unborn children will be there, a lower level of iron and deficiency of vitamin B will also create anemia, coma will be there, uncontrolled urination will be there, alcoholism, which is the behavioral disorder and chronic brain disease. Withdrawal symptoms. Now, withdrawal symptoms vary from person to person, and withdrawal symptoms of alcohol can be broken down into three stages. In first stage, individual will experience anxiety, insomnia, nausea. In stage two, there will be high blood pressure, increased body temperature, heart rate, confusion come with this stage. In stage three, subject will experience hallucination, fever, or seizure. Barbiturates. Barbiturates are an old class of drugs which are used to relax the body and help people sleep. And it became popular in 1960s and 1970s. It has been developed in late 19th century. These are practically the only drugs which are used as sedatives and hypnotics, and it has a sleep-inducing effect also. It has a potential to induce changes in the nervous system. That is, it slows down or curbs the activity of central nervous system. Its trade names are barbs, redbirds, candy. It can be available in pill, capsule, or liquid form. It is extremely dangerous if combined with alcohol. Certain factors such as age, health, condition, or any medication if person are using can increase the risk of the side effect. Short-term effects. The short-term effects of barbiturates are sleepiness or reduced sleep, inability to control body functions, relief of tension and anxiety, slurred speech will be there, there will be emotional instability, memory impairment, there will be problem in memory and in maintaining body balance. Long-term effects. If uses in long doses, the person will experience the long-term effects of barbiturates such as chronic tiredness will be there, fatigue will be there, drowsiness will be there will be problem in vision, sexual dysfunction, breathing disorders will be there, lack of coordination, slowed reflexes and responses, sensations and perception will not be clear. Withdrawal symptoms. Withdrawal symptoms of barbiturates are hallucinations, eating disorders, confusion, nausea, seizure, sleep disorders or reduced sleep activity, increase in blood pressure, pulse rate, muscle pain will be there. Benzodiazepines. These are the drugs which slows down the messages traveling between brain and body. It operates in the brain, causes changes in the emotional reactions, memory, and thinking. It is most widely used hypnotic, seductive, and central nervous system depressant. These are the drugs used for treating anxiety and tension. They appear to work by affecting a neurotransmitter called as GABA. GABA is a neurotransmitter called as gamma aminobutyric acid. So this drug increases the activity of GABA, which suppresses the activity of nerves and causes and creates calming and relaxing effect. These are swallowed. Some people also inject them. People generally take this drug for recreational purposes, and it is also used to treat anxiety and insomnia. Short-term effects. The short-term effects are depression, altered vision will be there, slurred speech will be there, nausea, constipation, dry mouth, loss of appetite or reduced appetite, impaired thinking and memory, drowsiness, lethargy will be there. Long-term effects. If person is using this drug in large doses, then he or she will experience long-term effects. Long-term effects are muscle weakness, lack of coordination and movement, slowed reflexes will be there. There will be problem in thinking, memory, and judgment. Mood swings will be there. Euphoria can be there. Slurred speech, hostile behavior. Withdrawal symptoms. Now, withdrawal symptoms vary from person to person, and withdrawal symptoms are nausea, vomiting, stomach pain will be there, dizziness, difficulty in sleeping, altered emotions will be there, anxiety will be there, hallucinations, seizure, poor concentration, delusions. This was all about depressants. In the next video, we will discuss about what are narcotics, its common types and effects. Till then, take care. Thank you.